Hi, good morning. I am Janine Pantino and today I will demonstrate the proper infant bottle feeding and birthing. Feeding your baby with a bottle can be a wonderful bonding experience for a mom, caregiver, and the baby. It's really important when feeding with a bottle that the bottle is sterilized beforehand and the very last minute you take the top off. That's because there's a lot of germs around us, and if by any chance you make a bottle and then it hits in a dirty countertop, if you put it on a baby's mouth, it's dirty again. Try to keep a protective bottle the minute you are about to feed the baby. When you're feeding a baby, you want to have head much higher than the legs so that the milk can go down comfortably. When you're feeding a baby, you want to have the head much higher than the legs so that the milk can go down comfortably. You want to elongate the baby so that the stomach and chest area aren't scrunched up together. So, holding the baby like this with the head much higher than the feet and the stomach, you just want to hold the bottle and gently push it into the baby's mouth. Sometimes the babies, when they are young, will reject the bottle and do a thirsting out. The way to help them through is to shake the bottle into the nipple a little bit in the baby's mouth and press the nipple at the top of the baby's mouth, and eventually they will latch on. Always want to make sure, most importantly, that the nipple is full of milk, because sometimes you may get distracted while feeding and may not realize that the fluid level has gone down. However, the more air that the baby gulps, the more crying they will have. There are many positions you can do on feeding your baby. You can put them on your lap and feed them holding their head much higher than their chest. You can do it like this, holding the baby in your lap while feeding the baby. You can also feed them on the bouncy chair as long as you get to look at your baby and talk to your baby. You can bond with them while feeding is very important. But remember that not every time your baby is crying is because they are hungry. Sometimes it means that they are not comfortable, like their diaper is full, they feel something bad. If the crying persists, make sure to check out with your doctor. Feeding should be really a beautiful experience for you and for your baby. Burping a baby is not always easy. Actually, many new parents consider it a challenge. We're going to demonstrate the two burping techniques, over the shoulder and on the lap. The reason you burp your baby is to release gas. This is the air that the baby may have taken in during the feeding. Babies feel better after burping, and the activity helps stimulate the baby too. For the over-the-shoulder technique, you can either standing or sitting. Try them both and see what works for you and your baby, or you can alternate. To start, hold the baby on your chest and see what works for you and your baby. Hold the baby on your chest so the baby is facing towards you, with your arms tucked under the baby's bottom, and support the back of the baby. You'll want to put a burping clothes in your shoulder in case the baby spits up. Use your dominant hand to gently but firmly pat your baby's back between the shoulders, working your way up and down, or you can also rub the baby's back after several pats. You can learn that the breastfeed babies tend to burp less, or sometimes babies don't burp at all. Burp for about a minute, then continue. The second technique, which is on the lap, placing a burp cloth on your leg position, with the baby facing either way. Notice that one hand is holding the baby's jaw, the forefinger and thumb are used as sort of wedge, with the palm supporting the baby's head up a little. Again, use your dominant hand to gently but firmly pat your baby's back between the shoulders, working on your way up and down, or you can also rub the baby's back after several pats. Remember, be patient as you learn your baby needs and likes.